Our final recruit was Dr. Eldon Spackman, who joined the department in December, so just coming up to a year. Eldon has a Master's in Arts and Health Economics from the University of Calgary and then did a PhD in Pharmaceutical Outcomes Research at the University of Washington. He then assumed a research fellow position at the Centre for Health Economics at the University of York in the UK, where he stayed until 2015, and we recruited him back home, as Calgary is home for Eldon as well. So Eldon.
Thank you. I also felt immense pressure when Leda suggested that I look at what happened last year, and I saw singing, and while I would be willing to sing, Rebecca was unwilling to accompany me, and so we couldn't come together. I just wanted to say that it's been a great 11 months. I've really enjoyed being at the University of Calgary. It's been a really good experience for me. I thought I would first, though, start with my expectations of what academic life was going to be like. And besides thinking that I was going to be something like a Jedi, I also expected it to be lonely. I thought that I would be writing in my office a lot, that I would be trolling the internet, trying to figure out what I'm supposed to be doing and looking for how the university works. I thought that things would happen very slowly. I thought that it would take a long time to get projects started. I thought creating collaborations was going to take me at least a year, that I wouldn't have the opportunity to work with students or to teach for a long time. But that's not what I've found. And it hasn't been lonely. There's an excellent health economics subgroup here at the University of Calgary, and they've given me lots of direction and mentoring, and they've been very, very helpful. I've also been working with the Health Technology Assessment Unit. Fiona Clement is the director, and Tom Noseworthy is the program advisor. And it's been great working with them and learning from them and sharing in the projects that the Health Technology Unit has. There are 7 graduate students, 3 undergraduate students, and 7 researchers at the unit right now. 2 of those graduate students and 5 of those staff are new to this year and have joined since I've been there. So we're growing very quickly, and so that's given me the opportunity to work with students and to work with researchers, and it's been a very good experience for me, and I've learned a lot doing it. The other thing I should say is that this year we were able to get another contract from the BC Ministry of Health, so we've been very busy with projects on top of the Alberta Health contract that the unit already had when I arrived. And so that brings me to the fact that it has not been slow. We have done a number of HTA unit projects, reviews in Pinel and Tarlov cysts. Very, very exciting, but they were policy relevant. We were asked to do them by the out-of-province committee, and we were able to provide some evidence for them and help them make a decision that they needed to make right away. Endovascular therapy, bilirubinometers. We recently finished a health technology assessment, and when I say health technology assessment, I mean patient, well, I guess we didn't do patient interviews in this case, but we did clinician interviews, systematic literature reviews. We were cost effectiveness modeling, budget impact modeling, policy suggestions. So these are big projects. They happen very quickly. They're very busy, but this was for the BC Ministry of Health, who made a decision last week about whether they were going to fund bilirubinometers in their province. And just to say that there was lots of other people that have been helping on these things. So Reg was able to go and sit in his office and ask him questions about everything and just understand the context for the research from the beginning, and it's been very helpful. We've been working on non-medical marijuana legalization. providing evidence for Alberta Health, but also for the National Task Force that is trying to provide evidence for the federal government on policies for legalization of marijuana. That's been a really interesting experience. There's no health economics in it, but there's a lot of evidence to review. There's regulations to consider. There's tax policy to think about for marijuana, and so that's been a very enjoyable project to be a part of. There's a number of other projects here that are just starting up, so we're kind of just starting up, one on palliative care, one on CT scans for pulmonary embolisms, and we've been working with Alberta Health on helping them with their drug policy, working with Glenn and Braden Mans and Fiona on that as well. And a list of other projects that I still have ongoing, from trials in psoriatic arthritis with economic evaluations. We just finished off one in prostate cancer, value of implementation, and frameworks for valuing genomic tests. So thinking about what is the value of these precision medicine tests, what are the things that we should be considering. And moving forward, all of my research is very policy oriented. I really enjoy that, like Rebecca said, the interaction with government, helping them make decisions that are better. That's what I'm interested in, is helping make better decisions, and that can work well. It doesn't always work well, and there's lots of things that could improve, and so I'm looking forward to helping provide evidence, develop methods to make these decisions implementable by the government. And they say that economics is the dismal science, and that's not what I have found in this year, that it's been, when applied to health in particular, it's been very, very enjoyable. So thank you.
Thank you, Eldon. And now I know why you're in the office at 7 a.m. You've got a lot of work going on. So 3 great recruits, and hopefully next year we'll be able to introduce some new recruits as well.